two steps forward we're making in our fight against the COVID virus. The first is a proclamation I'm issuing today that will improve our health and safety guidelines for the hardworking people in the agricultural industry. And we'll have Alejandro Sanchez and LNI Director Joel Sachs on hand to answer questions and comments by Eric Nicholson of the United Farm Workers after my comments. After that, I'd like to tell you about our testing strategy, another of our steps to protect our long-term care facilities. I'm joined by Health Secretary John Weisman to talk about those issues, as well as Authority Deputy Medical Officer Carissa Fatinos and DSHS Secretary Cheryl Strange, and also Assistant Secretary for Aging and Long-Term Administration Bill Moss to answer questions that any folks may have afterwards. I'd like to address the over 100,000 people in Washington who are working in the agricultural industry. We know that your labor is so critical to providing food for all of us, and we particularly are thinking about the 1.7 million Washingtonians who have food insecurity today in Washington State. We know that the production of healthy produce comes from the hardworking folks on our farms and fields. So today's proclamation is providing clear guidelines for both employers and workers that has been asked for, and I want to express my gratitude for those who worked in the collaboration to produce these guidelines. That work was not easy, and I know that today's proclamation speaks to your advocacy and commitment. You know, it was renowned labor leader Dolores Huerta who said, "Honor the hands that harvest your crops." And our state boasts some of the best produce in the world, and that's because we've got some of the hardest working people in the world. And we certainly know that every time we eat, there was a hand that provided our sustenance. And so we know we have rich soils, we have diverse climates, we've got large-scale irrigation. But mostly we have hardworking people, both orchardists and workers and farmers who are responsible for harvesting over 300 different crops in our state. And I know some of these are the hardest working people around. I lived in Inslee for a couple decades and knew many folks and saw many folks just doing this incredibly hard work, cold and pruning and hot in harvest. And frankly, these folks deserve more recognition what they do in our communities. So this crisis means we're fighting with our strength to help everyone, and today we're talking about agricultural workers. The task to come up with the right policies is challenging, from the fields to employer-provided transportation and housing and other congregate settings like packing houses. There's numerous points of risk for people who are working in agriculture. The striking workers in Yakima on the lines as we speak are clear in their calls that more needs to be done. We hear that message, and that's why we're acting today. So today we're announcing additional safety standards for COVID-19 prevention for agricultural workers across the industry. These standards built on the requirements set forth at the beginning of the crisis for all industries, with more specific provisions for the unique needs of this industry. This proclamation is going to protect workers in the fields, in packing houses for fruit and vegetables, and on employer-provided transportation. These requirements complete the remaining standards that really are necessary to implement a cohort model set forth in the state's previously released rules on housing. Here's how it works. Amongst the many things we're doing to protect agricultural workers, we need workers in small cohorts, not more than 15 people together, that are protected from exposure to other people working, whether in housing or during transportation. This model, if it's adhered to properly, can tremendously reduce the risk to agricultural workers because they're only exposed to a smaller group of people that can reside and travel and work together. So this will help us, if there is an infection, to very quickly trace the source of that infection, isolate that person in this cohort, And we think this is a tremendous strategy for breaking the causal chain of this infection. This effort requires significant changes, and we realize that. This includes requirement for all workers to have access to facial coverings on the job when they're not working alone. The state has procured and distributed 135,000 cloth facial coverings to agricultural workers across the state so far. And large work sites will have roughly 4 times as many hand washing stations as they previously did, so workers won't have to have a false choice between effective hand washing and getting their job done. So that's a quick rundown of some of the summary of the work we're doing. I'd like to now turn to Joel Sachs for a few comments about our work. Joel.
Thank you, Governor. As you said, agriculture is one of our state's incredibly important industries. We must all work together to protect workers from known workplace hazards on the job, like the coronavirus. Now, while COVID-19 presents unique challenges in keeping workers safe, there are many things that can be done to reduce risks. The requirements the governor is announcing today build on the work we've been doing over the past several months and provide a clear framework for protecting workers through things like physical distancing, increased hand washing, cleaning and sanitizing, training and education for work that's done in the fields, in warehouses, and during transportation. We want workers to know that we're here for them. They can contact us if they have a safety concern or want to file a complaint. We've been taking complaints and, where appropriate, performing inspections, and that work will continue. We want to make sure that workers know their rights. So we've been doing outreach through radio, TV, social media, and partnering with the community advocates. At the same time, we want employers to know that we have a consultation group. So if they need help figuring out the best way to protect workers, we're here and we're ready to provide assistance. We've provided consultations to dozens of employers, and we stand ready to help even more employers and growers. Because now, more than ever, it's critical that growers and agricultural workers work together to promote safety and prevent the spread of the coronavirus. At the end of the day, we believe that everyone has the common goal of ensuring that we can all put food on our tables and also ensuring those who are doing the work every day are able to stay safe and healthy. Here at L&I, we're committed to playing our role in making that happen. Thank you, Governor.
Yeah, Joel, I wonder if you want to talk about some of the cohorting strategy, how that applies during transportation, and also some of the pre-existing requirements for residential safety while people are in an agricultural industry.
Sure. So one of the pieces that we have worked on over the past few months is identifying those things across all industries that need to happen to ensure workers stay safe, and then addressing many of the unique challenges that happen in agriculture. So we've promulgated an emergency rule that talked about reducing the risk of the spread of coronavirus for those growers who provide housing for their workers. And what we did in consultation with advocates and growers is to identify a variety of requirements that would need to be met, and then different ways that growers could potentially think about implementing those requirements. One of the ones that we hit upon, and that you mentioned earlier, is for those communities where a grower has made a determination that they want to provide, they need to or want to provide housing, if they create what we're calling a cohort, which is a group of up to 15 workers who would stay together in housing, stay together for their meals, stay together when they're working together, and then not have interactions with other groups. That would be one way of trying to protect the spread of the disease. And when they did that, that would then enable the grower to expand and address some of the requirements that we have around social distancing and some of our other requirements. So in many ways, the option for the grower is ensure social distancing, promote a cohort model that creates these small groups of workers that give them a little bit more flexibility as it relates to social distancing.
And does that cohort model also apply in the transportation of workers?
Absolutely. So as growers are providing transportation, if they have a cohort group, they're able to have that group sort of in a slightly more contained environment. Whereas if you're transporting workers that are not in that group, then the expectations are going to be to ensure social distancing when you're on buses and vans, wearing probably a higher level of facial masks to protect workers from the spread of the disease.
Great. Thank you, Joel. And we have Eric Nicholson of the United Farm Workers. Eric.
Thank you, Governor. It's an honor to be with you today. And Director Sachs, thank you so much to you and the hard work of everyone at LNI. United Farm Workers has had the honor to represent farm workers across the state of Washington for over 25 years. During the scope of our pandemic, we have been in active consultation with these essential women and men to find better ways to stand with them so they can continue to fulfill their duties of making sure that we here in this state and across the country every day have food to eat, as you have so eloquently spoke about, Governor. Through the course of those conversations, we have learned about growers that have gone above and beyond and learned about the best practices that they have implemented. And we want to learn from them. We've also talked with workers about fears they have, and these rules go a long ways in addressing many of the issues that farm workers have consistently raised with us. And for that, we are deeply thankful. Some of the key points. There's been ambiguity about social distancing. These regulations make it very clear that those measures need to be adopted or other substantive protective measures be implemented. The provision, as Director Sachs talked about, information and training. Many workers, women and men, essential women and men, are going to work today fearful. They do not know what's happening. They are not aware of the coronavirus, the impacts, or more importantly, what happens, God forbid, if they become involuntarily quarantined or get the virus. These regulations require the employers to train workers on their rights and their ability to file claims so they can be made economically whole if and when they have to stay at home. We also are thankful that these regulations require employer-provided masks. That has been a huge issue, is that workers have literally been scrambling, trying to find masks on a daily basis that are clean, that are going to protect them in the work site. These rules clear out that ambiguity, make it very straightforward, and on a daily basis, clean masks need to be provided at no cost to employees. Governor, you spoke about the hand washing facilities. Current regulations allow hand washing facilities to be over 4.5 football fields away from where workers are. We know the importance of hand washing. By reducing that distance by a quarter, we're making those hand washing facilities much more accessible to workers and making very explicit the expectation of hand washing no less than 5 times a day. And finally, the issue of transportation. As we look at food production, we recognize that we're only as strong as our weakest link. And in the constructive conversations the United Farm Workers has had with farm workers, with our colleagues on the grower community, we've recognized in the middle of a pandemic, there are no sides of a table. It is a round table. And we need to pull together, and that is our chance to have the greatest impact, to flatten the curve and eliminate this virus. By taking the steps that the state has done to ensure social distancing and adequate measures are going to be addressed in transportation, we have now firmed up another link in our weak supply chain. And I just want to say, Governor, your words go a long way of affirming the essential work of farm workers. It has been difficult for many of our members who are very proud of the work they do to hear conversations and gratitude being expressed by the community for other essential workers, but many times farm workers have been left out. So deep felt gratitude for that recognition, and the women and men we have the honor to work with are tremendously proud of the work that they do, and very thankful now that there will be binding regulations to further protect them in exercising those duties. So thank you.
Thank you, Eric, and thank you for your leadership and your organization. They've been really helpful crafting these rules that have not been easy in the agricultural environment. And I want to thank some of the growers that have helped us work through this to learn some of the practices at work as well. I had a great grapefruit yesterday, and it was so good. I know somebody had a hand on that. I don't know who that was, but they certainly deserve protection. So I'm glad we've had a step forward on this, and we're not done in this regard. And by the way, I do want to point these out. These measures are very protective for everyone, including the growers themselves and their families, who are obviously really hard working as well. So everybody's going to benefit from this step forward. So thank you. Now I'd like to talk about our Washingtonians in our long-term care facilities, and these are some of our most loved members of our families. And I want to thank the people who've been working in our long-term care facilities. They've had some real challenges in a variety of ways to try to make it safe for their folks. And this has been a challenge, and they have risen to the challenge in many ways. And they've been so helpful. They've been helpful to our family in helping to set up a Zoom call with my 103-year-old. She'll get there. My 103-year-old mother-in-law. We've had some folks out at Ida Culver to set up a Zoom call with her, and we just really appreciate the courtesy and professionalism of people in these facilities, but we want to help them by adding some new measures of protection, and that's what we're doing today. So today our Department of Health is issuing an order that will begin required broad testing within our nursing homes and assisted living facilities in our memory care units. This is going to protect some of our most vulnerable residents, and we know why that is necessary. So I want to just go over some of the requirements now of this, and I'm glad we've now in a position to be able to add to the many things we have been doing already in our long-term care facilities. So under this order, all residents and staff in nursing homes will be tested within approximately 2 weeks, and that completion goal is June 12th. And all residents and staff in assisted living facilities with the memory care unit will be tested within about 4 weeks, or by June 26th. Facilities that have already completed a COVID-19 prevalence survey of residents and staff on or after April 1st will be excluded from this because they've essentially already done it. We're also requiring facilities to test all staff unless there's a medical justification not to do it. And facilities will offer testing to all residents and required to administer tests to all consenting residents. Now, there are already tests being done under previous orders to test in each shift staff when they come in, including temperature checks, and we're glad we've already done that under a previous requirement. To help in this effort, our state is going to be sending test kits and personal protective equipment supplies to our nursing homes and our memory care facilities, both for staff and for residents. Right now, the Office of Financial Management is working on those cost estimates so we can make sure we get that job done. In addition, our state will pay the laboratory costs for those tests for staff only. Residents will, presumably their insurance will take care of those costs. If facilities cannot meet these requirements in the time frame, they need to notify us so we can work to solve the problems to get this job done promptly. Now, this is just one of the steps we've already taken, and I'm glad that we have been working on this for some time. Our state has already sent strike teams to these long-term care facilities to provide on-site assistance with testing and controlling infections. They've had assistance with PPE use in response to outbreak with distributions through our our Emergency Operations Center. And folks in these facilities have been in Tier 1 to have access to what has been a very restricted supply that we've been able to obtain from the federal government and other sources. We've also previously provided guidance on infection control, and DSHS has been doing recurrent inspections on adherence to these infection control procedures. On top of that, our state's provided technical assistance to long-term care administrators, as well as webinars for administrators and staff to really try to prevent the spread of this dangerous virus. We're continuing work on plans to provide interval testing so that we can have repeat testing as time goes on. So we're developing an interval testing strategy for the rest of the long-term care facilities, such as adult family homes and assisted living facilities without memory care units. So with a little more detail about this order, I want to turn it over to John Weisman, our secretary, and Carissa Fatinos, who's really provided some great talent in this effort. John?
Great, thank you, Governor. Appreciate those remarks. And as you said, our nursing homes house our precious elders, and we know that they are at high risk for COVID and bad outcomes from COVID. So continuing to build upon the work that we have been doing that you mentioned is our goal here. And I just want to emphasize that this work started even before COVID was identified in Washington State. We were doing some of those webinars in advance with the healthcare administrators, letting them know what COVID was, what the symptoms are, and what infection control procedures were going to be very important. And as everybody knows, very early on in the epidemic here in Washington State, we learned that nursing homes indeed were a high-risk place where there were a number of outbreaks and infections. Thankfully, over the last month and a half, since really March, we have really seen a decrease in the number of outbreaks in our long-term care facilities, and that really goes to the hard work that you were talking about the healthcare providers in the facilities who are providing good care, who are paying attention to infection control, and as they've had the access to the personal protective equipment, et cetera, have been able to better protect everyone. So this order, which goes into effect today, really continues our work and now allows us to focus on those nursing homes and assisted living homes with memory care units, allows us to focus on those that haven't had an outbreak. For us to go in, test everyone, make sure that we don't really have any asymptomatic infection in those facilities, and if we do find some, to be able to, much like what you were talking in the earlier segment, be able to cohort those residents and keep them, in a separate part of the facility from others so that we minimize the spread of any asymptomatic infection as well. So we are looking forward to working and partnering with our nursing home and assisted living partners out there to get this job done. We are excited to have the adequate personal protective equipment and now the testing supplies to be able to carry out this mission and to assure that everyone is successful in being able to get this order carried out, as you said, for nursing homes within the next 2 weeks and our assisted living facilities that have memory care units by the 26th. And the reason we're focusing on those units with memory care is that we do find higher infections in our assisted living facilities with memory care. And in part, that's because folks with memory care issues, and my mom had memory care issues and was in a home, tend to wander and, need to be able to move around as part of their daily living. And we know that increases the risk of infection. So we have been seeing more infections there, and that's why we are prioritizing that group of folks. So we are looking forward to these results and learning just how much asymptomatic infection we might have in a facility. And with that, I think Dr. Fatinos is now just on the phone. She's been having problems with video. So Dr. Fatinos, I'll turn it over to you if you are on the line. If you are, you might be muted.
I think she's having some technical difficulties, so hopefully we'll try to get her early today.
Not hearing her. I was just going to say, so we call this a point prevalence study, which basically means that by surveying all of these facilities in a short period of time, we can actually determine what percentage of our residents and staff in these facilities might have COVID-19. Which will help us understand just how much infection there is or the potential for spread. Again, the advantage of doing this right now is that we're identifying people who aren't necessarily showing symptoms because, as the governor said, we've been screening staff for symptoms, we've been screening residents for any respiratory issues, and hopefully quickly identifying anybody who might have symptoms suggested COVID and then getting them tested right away. And if there has been an outbreak, then going in and actually testing all the residents and staff at that time. So this really just continues that work. And I think that's some of what Dr. Fortinas was going to cover.
Well, thanks for filling in, John. If we get the doctor, raise your hand, doctor, we'll get you in. I had a couple comments, just a short comment before we stand for questions. One of the things that I think is really important to think about when we think about our loved ones in these facilities is that we can really protect them outside of the facilities. One of the things we can all do to protect people in these facilities is to try to reduce the rate of infection in the environment outside, because the more infection there is outside, the more it gets into these facilities. And it is very difficult. We're testing the staff.